And like I said, if you have any questions, pop them in the chat and we'll get them to Heidi. If we run out of time or if there's something we need to get back to you on, we will make sure to send that out to people. So I am going to turn it over to Heidi. Heidi, SD and I are here for you if you need us. Otherwise, we'll let you go ahead.
So much, Tara and Esther. This is Heidi Hotvedt, and I know I've presented to some of you before, but there might be some new directors on the presentation today. So we'll be sharing my screen here, and we can start the. I have a PowerPoint, but like I said, we can answer questions kind of as we go along. I'll be covering some of the new guidance documents. Okay, hopefully everybody can see my screen. I've got my contact information on here. So my role at the Iowa Department of Public Health is the Healthy Childcare Iowa coordinator, and our Healthy Childcare Iowa is our program where our childcare nurse consultants are part of our team out in the local areas, working with childcare providers to provide consultation, guidance, and help with health and safety questions. My contact information is on the screen. You can always email me or call, and we have a really great system. So if you normally would contact, of course, your local nurse consultant first, but as we know, sometimes things happen where you can't get a hold of somebody and you need an answer right away. So you can always give me a call or an email, and if I'm out of the office, then you'll be directed to call kind of my backup. So we do. We're here for you because we know, especially, I mean, always we're here for you, but during these times of COVID, sometimes we need questions answered sooner than waiting a couple days. So just wanted to give you that contact information. And then also our Healthy Childcare Iowa website is a great resource for information. And I'll actually share my screen about the website as we go through the presentation. So just wanted to kind of start right off. We've had some updated guidance documents from some DHS IDPH guidance documents that we've had now for, I can't even think, April, I think is when they first came out. And we have had some updates this past week. So on September 30th, we had updates to both the COVID-19 childcare guidance document and then also to the case reporting and outbreak responsibilities guidance document. So we're going to talk a little bit about some of the information on here that I just want to point out, and then we might take some questions about these specific guidance documents as we go along. Like I said, it was updated, the childcare guidance, and that is on the DHS website, but is also on our IDPH, link to our IDPH website and to our Healthy Childcare Iowa website, just so we all have the same information. And I know it's linked in CCR&R's website, so we've got you covered if you're looking for it. But I would refer you to this updated guidance because, as things changed, we've included some information to try to help providers as we've kind of gone through the pandemic and with different situations and different things that have come up or changed from CDC or from our state team. In the guidance document, and this was the previous one that was updated in August, was that face coverings are encouraged for staff and school-age children. And I'd really just want to reiterate that, if you haven't started working on putting face coverings into practice, I would really encourage you to work on that and to look at the guidance document, and then also refer you to the Iowa Department of Public Health website. There's a wealth of information on face coverings, how to even, guides on how to sew them, how to make them, how to wash them, how they should be worn. So everything regarding face coverings really on the IDPH website as well as the CDC website. And the reason that we're really encouraging those face coverings is, research is showing that face coverings are effective with helping, prevent or to slow the spread of, potentially the virus. Cloth face coverings are not the same as a medical grade, face covering. However, we do know that they are effective, and really most effective when both the staff and children are wearing them. So of course, those are only children over 2 years of age. So we do not have infants or younger children wear face coverings for safety reasons. But for those older children, preschool age and up, really encouraging that you put those into practice if you haven't already. And our local nurse consultants are really a great resource also for kind of just walking through some of those situations where it's like, okay, they know your site and they can direct you as to, okay, this would be a really good place for storage. I think that's probably the question that comes up the most is how do we store them when we need to take them off? The information also included information on the face shields, and there has been some conversation back and forth about face shields and are they effective, and according to the Centers for Disease Control, face shields need to be used with the face covering too, so it shouldn't be just the face shield. And I know there's been some information, some back and forth questions about that. I know that have been brought to my attention, and we are following the CDC guidance related to face shields, and that cloth face covering should be also in use if you're using face shields. The next thing, this was on the previous guidance document about the importance of keeping groups static and limiting and staggering the number of people in communal spaces to allow for 6-foot distancing. And really that keeping groups static and limiting the number of people in a communal space. So, limiting the groups, so if you're going out on the playground, making sure that if the best practice would be that you'd keep just the one group of your children from the one classroom on the playground and no other groups with them at the time. But we know sometimes that doesn't work. So how can you look at your space and say, okay, we're going to alternate use of equipment, or we're going to keep one group of children from one group classroom, and they'll be allowed this area, but we're going to have maybe some teacher-led activities done on the grassy area with the other group. So they're both maybe out on the play area at the same time, but they're not in the same space. And that's really that keeping those groups kind of together, and limiting that number of people kind of in that communal space. And we say that even with staff, when you're having staff meetings, having a group in a small staff room, even with wearing masks, really puts a high risk for potential of disease spread. So important to really, face coverings are important, but to try to maintain that 6-foot distancing when possible, and definitely with limiting the number of the staff in like a one group area, and limiting that with groups of children that are in the same shared space. So that's something that I would draw your attention to. And then the continuation of health monitoring, if possible, that's kind of an if feasible, if that's working for your program, is to continue that health monitoring. If you cannot continue that health monitoring, have parents be doing that health monitoring prior to coming into the program, because we're just going back to that basic from the, I think, first guidance document that we had come out that said, when children are ill, they need to stay home. When parents, are ill at home, the children need to stay at home with the ill parents. If staff are ill, they need to be at home and not in group care, because when we allow people to come into care that are ill, that risk that maybe they just have something that they don't think is COVID, they just maybe didn't feel that great that morning, or, they're running a low grade temp, but it's 100 and it's not 100.4, so that we're going to allow them to be in the program. And the important thing is just that, really when a child or a staff is ill, they need to not be working, because that risk is there. And that we really say if they're symptomatic, so if they have symptoms of COVID-19, they really should get tested. And we encourage that, because without testing, we really don't know what the disease is, or what's going on with the child or the staff. And I actually had this question come up yesterday, and it was a parent that really wasn't wanting to have their child tested. They just didn't feel comfortable about having them tested. And I said, this really isn't much difference than what we normally do with influenza. This time of year, if a child is exhibiting symptoms of influenza, they will get a nasal swab for testing for influenza. So I tried to put it into that, this is not an unusual request that we would want a child tested. Same with strep throat. If a child has a sore throat, often, our staff, they would get tested for strep. And so, so if they're having symptoms, trying to put it in that mindset of testing will just give you the answer if that's what's going on with the child, if it's COVID, because then we do know then if it's, if they're having symptoms and they are negative for COVID, then we're not, having to do the close contact quarantining. If they test positive, they do. So knowing if they're symptomatic and get tested, then at least we have that information so we can move forward on that. And the Test Iowa, for children over the age of 1, Test Iowa and older children, of course, and staff are a priority group with the Test Iowa test site. So that's something that you can go online and go to the Test Iowa site and fill out the information to get a testing. I haven't seen, I don't think any chats pop up just yet on this document. Am I correct on that? Okay. So just, I'll kind of go to the next one. And like I said, if you have questions, and I am going to cover this face covering and quarantine guidance document that also has come out. So, but I do want to go to this next guidance document update, and then we'll talk a little bit about kind of that close contact and the quarantine guidance. So our case reporting and outbreak guidance was also updated September 30th. And that, that guidance, if you haven't had to, I'll say if you're a program that really hasn't had to work through this, good for you that you haven't had positive cases, because it's challenging. I usually get the phone calls or the emails when those positive cases or those, of course, those outbreaks. That's when I become involved with tracking when those situations occur in programs. And it is very stressful. So I just want to say we understand that. It's overwhelming. No one wants to know, no one wants to hear that a staff person who's been in your building just came down with COVID, positive test results, and now you're trying to figure out close contacts and walking through that. And we're here to help with that. So this guidance document really, talks about what do you do when there's a confirmed case and what do you do when there's an outbreak. And so an outbreak is 3 or more confirmed positive cases in staff or children, and they not in the same household though. So if it's 2 children that are positive from the same household, then that isn't considered moving into the outbreak status until it's actually 3 different individual households that are involved. And so when the confirmed positive case, happens, refer to this guidance document, reach out to your DHS licensing consultant, and then they're going to collaborate with their local nurse consultant and local public health. So really to help walk you through, who are those close contacts that were involved with that individual. They would need to quarantine for 14 days or possibly longer, depending on the situation. And then they're going to walk you through that quarantine, that new IDPH quarantine guidance. And I'll actually show that guidance document to you in just a minute. But the quarantine IDPH guidance document is really looking at those situations where who is the close contact, and they're looking at was there mask cloth face coverings being used that as a added protection for staff and children. And it may then determine if they would be considered a close contact or not, even if they were within that 6 foot space of that individual. So close contacts, we always say is an individual that's within 6 foot of a person who has a positive case, and that they've been in that person's close contact for 15 minutes or more. And so that's one thing that, as a program director, as a center, you're going to be looking back at, okay, where was that staff person at, or where was that child at, and where did they interact with other groups of children, or who were they interacting with, and then trying to determine those close contacts. If you are, having masks of both being worn by staff and by children, then there may be a determination that they wouldn't necessarily be a close contact determined by an infographic that I'll show you. The reason we quarantine is we really we're wanting anyone who is involved, in close contact of that person that was infectious, that they're staying home. And the reason they're staying home for 14 days is that's the period of time from exposure to the identified positive case that the person could develop symptoms within that period of time. So that's a full 14 days, which is very lengthy. And what they're doing during that 14 days is really monitoring for symptoms. So they're staying home, staying away from others, and monitoring for symptoms in case they have the disease outbreak themselves. And that can be challenging for families, as you can imagine. And I know you've had that question, I'm sure, a lot. And the other question I get is, for isolation, a person who is diagnosed with COVID, they're told that they need to be in isolation for 10 days. Why is the close contact quarantining for 14 days? And that's because the way the disease process works is that prior to testing positive, you're really looking at when did that person have symptoms, and then we look at a period of time prior to those symptoms starting that they would have been shedding the virus in their system and possibly exposing others. So we always go back when we're looking at close contacts within the last 48 hours. And sometimes, depending on the person's illness and when their symptoms started, or if they were asymptomatic, the local public health would be looking at that period of time. But the quarantine is actually 14 days. So I know there's been some questions about that in terms of isolation versus quarantine. I'm going to just keep going unless I see something. So like I said, for isolation guidance, if a person is having symptoms of COVID-19 or have tested positive for COVID-19, that DHS is following the CDC isolation rule. And that is that you can be around others at least 10 days since the symptoms first appeared, and 24 hours fever-free without fever-reducing medication, and your symptoms have improved. So we've had a lot of questions, and I know I've talked about this, I think the last time that the Department of Education has a guidance document that's a little bit different than what Department of Human Services isolation guidance is. And we're aware that they're not fully aligned, but I think it's important to think about this, school system situations are different. Children are older. Children, it's easier. I mean, I don't know if it's easier, but it's more feasible to be 6 feet spread apart for older children. And it's more feasible, of course, for having cloth face coverings in use for both staff and children. And most programs or most school districts have instituted that requirement for their staff. In childcare, it's different. We do a lot of hands-on care. We're really working with children in a very close space. Younger children wouldn't be wearing a mask because they wouldn't be able to. That wouldn't be safe, if they were under the age of 2. And so your risk for exposure, of course, is different between those two situations. And the other thing we really would, we would love to have completely alignment with the school system. I know they're looking at, when they look at exclusion of children, they're looking at kind of these high-risk symptoms of COVID-19 and the low-risk symptoms of COVID-19. And at this time, DHS is following the CDC isolation rule, and CDC does not have a high-risk, low-risk at this time. That could change, so be aware if you see that information change, that could change. But at this time, that's what we're following is the CDC isolation rule, which would be the 10 days, the fever-free 24 hours, and that symptoms have improved. This is very challenging for families and for providers to have children out of care if they say they ran a low-grade temp and they had a sore throat, and normally we would allow that child to be back in care. Say their symptoms improved, or they were diagnosed with strep, and so they start on an antibiotic and they were fever-free, and we would allow them back into care. But right now with COVID, we do know that we have had some cases where a child has had or staff has had a sore throat and a fever and ended up with strep and positive for COVID. So if we don't test for COVID, we don't know if they're also exhibiting COVID-19, and that's the challenge. So I'll go back to what I said previously on the previous slide is people with symptoms should get tested, whether it's staff or children. We really need to know if their symptoms are definitely what their symptoms are and if they're positive for COVID. So I guess the good news from that is, if they have symptoms of COVID-19 and they test negative, then they can return once they're fever-free, and then they go to, it's 24 hours. So that does help to get people back into care sooner. And that's something that I would encourage you to, have in your health policy. And I know that's something, if you really haven't, come out with a COVID specific health policy, and it's something that you're going to be updating, as needed. So just to make sure that, we're here to help you with that. That's our role as local nurse consultants. And as my role at the state is to help walk you through that of what your policy is going to be. Now for staff, in the guidance document, there is some specific information, and it's in the childcare guidance document. It's actually on page 5. And this does allow for staff, so this is a little different. So I just wanted to point this out that, ideally staff that are identified as close contacts, and if they're in quarantine. So this isn't really if they're in isolation and they actually have COVID, but if they're in quarantine or should be in quarantine because they've been exposed, we do know that because of staffing shortages in childcare, that there is some guidance in that. There's a line in the guidance document that, there are going to be possibly some childcare settings where that's going to, cause a staff shortage, and that you could choose to allow the staff to continue working in accordance with recommended safety measures. And that you would want to just make sure that you're following the guidance related to regular monitoring, wearing the mask for the 14 days after the last exposure, and then making sure that you're maintaining 6 feet distance. So that's just a little caveat there, that if you have staffing shortage, that could be something you could put into practice. I did talk with a program that needed to do that a couple of weeks ago, and she said, well, I'm just, normally that staff person would be in an infant room. And I said, well, that's not going to follow the guidance. That would not work, because there's no way you can maintain 6 foot distance in an infant room. Is there a possibility that staff could work in a different room that would allow for 6 foot distancing from the children? And that actually worked out for that program. So just kind of walking through those scenarios and situations. And that's, like I said, that's what we're here for, to kind of help you through those. I think I saw a couple chats come up, so I'll go ahead and take those now and before I move on to the next slide. Let's see. Oh, shoot. Sorry, I was trying to bring my chat up and I can't. Maybe Tara, could you read the chat to me?
Yep.
Okay, sorry.
I got it. Yep, she says a challenge we are having is runny nose or cold. These are words parents are using and not thinking these are symptoms, and the pediatricians are telling them they don't need to test.
Yeah, we've had that question come up a lot, and that's something where I kind of go back to, is that a normal situation for that child? This time of year, there, a lot of individuals, adults and children will have kind of those runny nose, or that kind of those symptoms of, allergies because of, during harvest, we see that sometimes. And so, it's one thing if you're not ill and you have a runny nose and that's kind of a normal for you. But if this is where you have the child that's having symptoms and they're ill, so are they ill with that? Are they ill with the kind of that runny nose, the run down, maybe they're not running a fever of 100.4, but they ran a 99 over the weekend, so really evaluating those illness. I do know that sometimes, physicians are saying that it's not necessary to test with those symptoms. And actually, I do have a resource I will show you kind of how to go through, is it a cold? Is it influenza? Is it COVID? And I'll show that to you. But I think the runny nose is probably the hardest. And we do know that, some kids have a lot of runny noses, you know. So I just kind of go back to what is the norm for that child. And then, you know, the parent does have the right to ask for, they can explain to the physician that they need to have a test done, and they can request that, and that should be honored. If the, you know, if they have a provider that is not willing to test, and the child's over the age of 1, they can go to the Test Iowa site and fill out the form for that. Great question. And what was the other one, Tara?
That was the only one I saw.
Oh, okay.
I know it said 2, but I think she just typed in twice.
Okay, great. Okay, I'll just keep going to the next one, and then we'll take questions as they come. So, so this is the new kind of guidance document, or the infographic, that Iowa Department of Public Health recently posted, and this was just posted this morning actually on our Healthy Childcare Iowa website, so it's kind of in one place, or at least the link is. But this is attached, actually linked into the guidance document from Department of Human Services and IDPH about when to quarantine. And so this is specific for businesses, education, and childcare settings. I've got the link on here, and what I'll probably do is I'll just kind of run through it. Can you see that, or would it be better for me to bring it up on the website? I don't know if people can zoom in and see it. Let's see if I can. I don't know if that's going to help. Is that helping some to zoom in? Hopefully. Okay, so this is really for specific related to business, education, and childcare settings. And it talks about kind of the different scenarios where an individual would be considered a close contact. And so, like I said, that close contact is if they've been within 6 feet for a COVID-19 positive individual for 15 minutes. And really looking at, you know, would that person then need to be quarantined? So it's really specific. And if you can kind of see here, so you can kind of see, so if everyone is masked, so, you know, I look at this as kind of the, you know, here's the staff person and they have their mask on, and then the children have their masks on. And so would all of them be, you know, when the masked individual tests positive and the close contacts are wearing masks, you know, would they be needing to be considered a close contact? And they would not, okay? So the close contact is still going to isolate, you know, but there's no quarantining required. So if you kind of see, there's no quarantine requirement. So say you have a close contact, so you have the children are wearing their mask, but the staff isn't wearing their mask. We'll say it that way, okay? So the staff person would still be isolating. And unfortunately, the children would be quarantining as well, because there isn't that mask protection, okay? The next scenario would be, so you have maybe a group, and you have some that are, you know, the staff are masked, some of the children are masked, but some are not, but they're all in the same group. And I see this more probably in mixed age group care, probably more for programs, maybe for home programs where they kind of have that mixed age group. So they have the infant and toddlers, but they're around the older children. So the older children maybe have masks on, but the you know, the younger children don't, of course, and then the staff have their mask on. And so the individuals then in that group would be, the ones without masks would have to quarantine, okay, for the 14 days. The ones that had their mask would be self-monitoring. So they still would monitor, but they wouldn't necessarily need to quarantine. And then if no one is masked, of course, you know, you have a positive individual, they're isolating for the 10 days, and then the close contacts are in quarantine for 14 days. So this is just trying to be, IDPH is really trying to be helpful in terms of giving those scenarios and actually showing kind of how that looks. I think for childcare, the challenge, and I'm just going to kind of talk about this, I actually just talked to Tara about it a little bit earlier, because this is a question that was brought to her, and actually I've had the same question brought. The challenge that we've seen in childcare is we have many times when children are taking their masks off in care. and they need to, they have to. It's not where we're going to say, well, they shouldn't take their mask off at all, at any time, but they need to eat. And we know we can't wear a mask when we are eating. And when they're taking a nap, when they're on rest breaks, we do not, CDC guidance is that they should have their mask taken off and stored. And so that's challenging because now we have unmasked time where then this would come into play. And this is what we would walk you through, and what local public health would walk through is, was there time when those children did not have masks on, and if they were within 6 feet of that individual who was positive, then unfortunately they would need to quarantine because they would be considered a close contact. So that is a challenge. And what I would say is, that's where I say go back to the beginning of my conversation about keeping groups static. So if you can keep the same group together, so if you're, for table eating, for example, having one group at a table and another group at a table, and keeping those static every day, for every meal, and not having kids mix between the tables, or not having staff mix between the tables. Because when the staff is sitting, and it's very hard to maintain a 6-foot distance during eating, and so because that's difficult to achieve or almost impossible in a lot of programs, keeping that static group closely together and maintaining 6 feet between the tables would then allow that if someone in that table group tested positive for COVID, that would not necessarily be considered a close contact of the other group, because the other group was not within 6 feet, even though they had their mask off during eating. I don't know if that makes sense. I think the other thing is sleeping arrangements. We've always, Health and Childcare Iowa and our nurse consultants have always encouraged, 3-foot spacing between cribs and between cots. And, now our recommendation would be 6-foot spacing. Well, we know that's really challenging to do 6-foot spacing. So in the infant room, I don't know that, if that's not possible, definitely the 3-foot, but in terms of close contacts, probably in an infant room, all would be identified as close contacts if there was a positive case in the group. But for those older kids on cots, definitely you could again keep those groups static. Try to keep that group that all table eats, they all are in the same area, maybe for where they sleep, and then we keep the other group to the other area, so that they're not, so when they have their masks off, they're not within close contact with that other group. So those are just some scenarios that like Tara had a question on this and has been brought to my attention. So just trying to think through those scenarios and trying to work through that can be helpful.
We do have a question, Heidi.
I see a couple. Yeah, let me take those.
Some of it is SD posting, I think, the document that you're sharing, so people
great.
can
Okay.
click on it. But we have a question. So if an older sibling tests positive, the younger child in childcare should self-isolate or not attend childcare because masks aren't worn in the home. Yeah, so if a child is a close contact of a sibling who is tested positive, that person actually should be quarantining at home, and they should be actually maintaining a distance away from that other sibling who's positive. And that's where we say 14 days or longer, because it could possibly be longer, because it's actually, you have to quarantine from the last time you had an exposure. So if those family members are all in the same location and are not maintaining 6-foot distancing, which I know for a lot of families, that's what ends up happening, then it's the last time that they had an exposure. So if that person is in self-isolation who's positive, they're actually considered an exposure up until that 10th day. So it could be 24 days of quarantine for that sibling. So there is, actually I was going to share that link, but there's a really great link on the CDC website going through those scenarios, and actually with calendars, we use them a lot to explain that. And I would encourage families to see that, because if 24 days out of care is a long time for a family member. So if they can somehow separate those siblings from each other, that would be best
so that they could do that. Any other questions on that one?
Nope, that's the only one in there so far right now.
Okay, I'm going to keep moving on then. I just want to show just really quick, our Healthy Childcare Iowa website is a good resource for our COVID-19 information. If you can kind of see that our website has tabs, and we do have our Childcare Nurse Consultant tab, which is where you would see the state map and find your local nurse consultant and my contact information and our backup TA team contact information on that map. And that would be so that it showed the map, and then it's that first page that you'd see that contact information. If you scroll down to the printed products tab, then it'll bring up the printed products to download. And I'm sure many of you have been on our website and have been to this site, but we do have a COVID-19 resources area, and we do have all of the what I would call those important documents that childcare, they need to find, and to try to find them sometimes on the CDC website or on the IDPH website, it's challenging. So I pretty much highlighted the ones that are really kind of frequently needing information about on that website. So if you haven't been to our website for a while and looked in our resource section, please do. And then we also have the link, of course, to the Department of Human Services website and to the CCR&R website, because there's a lot of great information on all of our websites to share. The next resource that I would want to point to, this is actually a symptoms chart that was put out. That's really helpful for looking at those. We talked about those symptoms of how cold and flu and allergies and asthma and COVID and how similar they all are. So there's actually a really handy chart. This is something that you might want to post for your families to see. It really is helpful to kind of go through the chart to see, what are the child experiencing. Could it possibly be COVID? I think, we're running into influenza season. That's going to be really challenging. Right now, I think we have a lot of allergies going on, some exacerbation of asthma. Go back to, if the person is ill, I always say that, is the child ill from this? But then also work with your local nurse consultant, because it's important to have in the child's chart, if they have seasonal allergies, and in the fall, they're always, we're having a runny nose and sneezing. It would be great to have that in their chart, and for the doctor to actually document that, or for the parents to at least document in the health record. If you have a child that has asthma and you don't have an asthma action plan, please work with your local childcare nurse consultant to get the asthma action plan put in place. So you have in there that the child does have coughing and does have allergies and does have problems with coughing and exacerbation in the fall, or you have those information updated on their asthma action plan, so that would really help for documentation purposes, that that this child, that's their normal for them. And they're not actually in the middle of an illness, but it's more of their normal disease process. So that would be something that might be helpful for you to post and to work with your programs on. So I have that link there. And then
we have
also
a question, Heidi.
Oh, sure. Yep.
This question is, and I believe, so what if we had a younger child in another center show symptoms and is in self-isolation until they get their test results back? Can the older child, which I'm assuming is school age, so that's why they're maybe at two different programs,
okay,
can the older child in my program attend as long as they have no symptoms?
Yeah, our guidance document is specific related to positive. So positive results is when we quarantine people. Now, we do say if a child's parent is ill or having symptoms of COVID, the child should not. And that's in the guidance document. It says if the child's parent is ill, they should stay home. If a staff person lives with someone who's ill, they should stay home in their household. So, I mean, it is clear that way. And then if they're positive, then of course we go that next step and identify for close contacts. We do not have in our guidance document at this time that children of siblings that are having, illness symptoms should be also, quarantined until they get to be positive. Then that would turn into a different situation. That's a best practice guidance. I can only say but what's in our guidance document, but you can always, with your own policy, determine that would be best to have the whole family, you know, stay home until and out of care until you actually get the test results. That's a challenging situation. You hate to have, you know, family members, you know, having to stay home waiting for test results, but there is a potential that then if that, you know, child is positive, then that person, you know, who was, you know, in care during those kind of waiting for those results, you know, that sibling, you know, they could have potentially been exposed and then, you know, potentially could have been having maybe asymptomatic or not having, you know, maybe very mild symptoms, and they you know, 2 days later then they start having symptoms, and now they've been in your care, and then now you're looking at a possible you know, outbreak situation. So that's just something that you know, following our guidance document, we do not have that in there, but if that's something that you as a program decide to put into practice, you can put that in their policy. Any other questions just yet?
Nope,
Okay.
that's it right now. Beth is asking for the link for the chart, so I think SD might be working on that to get
great.
that.
Thanks.
Yep.
Thanks for doing that. And I can always share slides too if you guys want me to do that afterwards. The EPA has a really great, okay, everybody is so struggling. So we have struggled and struggled with the EPA website for looking up information for disinfectants, but they actually have a new search tool. I don't know if anyone's tried it out yet, but you can actually go on the link here and search for disinfectants effective against COVID-19, and you can browse by certain things. You can put in the contact time, you know, what I'm looking for something with maybe a 2-minute contact time, and then you can do a search by that, and then it'll bring up the products that are that fit in that category. You can search by, of course, EPA number, by product name, and also by ingredient. I did have a program that was looking specifically for a non-chlorine product. They really were looking for a peroxide-based product, and I said, well, this search tool allows you to do that now, which is really great. So if you haven't seen that, I wanted to share that as a good resource for everybody. And then, of course, here's our map, and I did want to point out that many of you maybe already knew that Darla Budekoffer has had an opportunity to take a new position for her. We're very sad that she will be leaving the nurse consultant field, but really excited for her and this opportunity that she's taken. And so that does leave a vacancy for their program up in she's kind of all of this light green area except for Dubuque. So if you're needing any local nurse consultant services in the meantime while they're hiring for that position, and that will be hired, but so there's no concerns there, but I know that takes a process of getting someone hired and getting the position filled. So Darla did put out an email of contact information for questions for the different area, for her area. And also I am here and available to providers to cover for concerns or questions. And then also Deb Geimer at our Healthy Childcare Iowa website is available. So if you go on this, click on our consultant map, like I said, my contact information is on there. Deb Geimer's information is on there, as well as we'll be sharing, I know, that information of kind of those local contacts, because sometimes you're just needing the number for maybe the local public health nurse to talk to, you know, if you have a positive case. So if you needed that information, I know Darla shared that for programs to have, but we're always here for you if you have questions. And then that's all I have. I didn't know if I didn't see any other. I'm going to stop sharing, and then I'm going to go to, because then I can see my chats. So.
Yeah, I think that the chats were mostly SD putting in links for everyone.
Okay, great.
Does anyone have any questions they want to add to chat or raise your hand to ask? Don't know if I'm seeing any hands right now.
Heidi, I have a quick question. Maybe you could just touch on, now that we are going into holiday season, is there anything that you want to say or would just want to just bring up as a reminder for our providers. As you know, now it's time for maybe some outdoor activities that maybe they've been isolating from. And if there are any resources that they could maybe go to in response to, I'm just thinking like Halloween or something like that. Is it maybe a CDC thing or on the Iowa Department of Public Health? Where and what do you think of that, and where could they find resources?
Yeah, there's actually on the Iowa Department of Public Health website under, I think it's the public tab, but they have something specific about Halloween. So if you wanted to go on that, that would be helpful. I do know that I've had the question a lot about travel and programs that have had family members that are traveling, either they're anticipating traveling, even coming up for Thanksgiving for the November, dates. And so, we do not have a travel, concern if they're in the state of Iowa. But they're really the only travel concern right now for IDPH as of right now, because that could change, but there are still restrictions if a person travels internationally. That is that when they return, they do quarantine for 14 days. We do have some travel advisories out from other states, so that's something that you might want to consider in your own policy. Would you want to refer to what the state was that the person was traveling in? The best practice, of course, is to make sure that people are wearing their face coverings when they're traveling and staying out of large groups and maintaining 6-foot social distancing. Fortunately with air travel, they are requiring everyone to have a mask, face covering on during travel. But those are some things to consider for sure. And then I think probably the biggest challenge that I see kind of coming up is, as we're coming into flu season and coming into winter, if we have the opportunity right now to really have some great outdoor activities and outdoor opportunities for physical activity, but also just for learning. So right now we have some great weather going on, so if you have opportunities to go outside and bring your classroom outdoors by doing things have a blanket on the grass or doing some activities out on the sidewalk where they're doing their math, really being out in open air, I think is really helpful for kids. It's, I really worry about children and the amount of times that we're really having them kind of in close situations, indoors, with their masks on, really limiting, sometimes freedom of movement, because we're trying to keep these group sizes together and trying to limit that exposure, those are all good things. So I do think for just kids to have the ability to have outdoor time, especially when we don't have to do all of the coats and boots and snow pants and all of that, to utilize that opportunity right now, because I think that would just help for everybody feels better when they have just some time outdoors in the sunshine and the fresh air. And I know that some concerns that have been brought to my attention just from some other nurse consultants and health consultants across the United States about really just that we're limiting a lot of movement of kids, and that's really causing a lot of behavioral things and a lot of concerns with children. So I didn't see any other chats come up just yet. I know there's a lot of information, and I do hope that the guidance documents are helpful. I know, we work with CCR&R and with DHS and with local public health to kind of help walk you through, different scenarios and different questions that come up. These are challenging times and things change often, and that becomes even more challenging. But I think staying in the loop and trying to stay engaged, I think it's great. CCR&R always does a great job with sending out constant contacts, and we'll continue to do that as things change. But working together through all of this is why it's working. I work with other states, and other states have not had the success that Iowa has had with being able to keep our doors open to childcare. So I really applaud all of you for all of the hard work that you as providers and you as consultants have helped to keep our state, functioning and open to childcare, because the states that haven't are really struggling. They've lost a lot of childcare when they're trying to reopen now. So, any other last questions or concerns or anything?
I don't think so. Esty, anything on you?
No, thank you so much, Heidi, for coming. And just a reminder, guys, I put in the chat our email address to send any other questions you may have that come up, or if you want to ask something privately or a concern you have privately and not be recorded, you can send it to that email address. Thank you, Heidi. Thanks everyone for attending.
Thank
Great,
you.
thank you.
We'll
Have a
send out
wonderful
the
day.
recording once we get it. And yes, thank you so much, Heidi.